Okay. So hello everyone. Welcome to our virtual PathSIG event for this month in February. This event is titled From Medical School to Practice. And today we have three great panelists with us. I'll let them introduce themselves, but we're really going to be kind of having a discussion during this event, from going really from medical school through residency, fellowship, if you do decide to do fellowship, and then as a practicing attending. And so we'll kind of let the panelists introduce themselves. We'll start with Veronica, if you would like to start, and then Dr. Anna Dar, and then Dr. Julia Choi.
Hi guys, my name is Veronica. Thanks so much for having me today. I'm a fourth year medical student at University of the Incarnate Word in San Antonio, Texas, and I'm applying pathology. So just getting ready to submit my rank list. And if you guys have any questions about applying or away rotations, anything like that, I would love to chat about it.
Hi, I'm Anna Dar. I'm a current one of the two Heme Path fellows at Vanderbilt University Medical Center, and am a former or a an alumna of the University of the Incarnate Word DO school in San Antonio as well, and happy to talk about kind of the transition from med school to residency to fellowship.
And hi, I'm Julia Choi. I am presenting the attending perspective. I am a practicing pathologist within a private practice called Oculus Pathology. Our corporate is based in Austin, Texas, but I sit primarily in San Antonio. So I welcome your questions about the attending perspective. Thanks.
So thank you, panelists. So everyone be welcome. This is very informal discussion to help any budding pathologists that are on the call. And so really the agenda for today is kind of we have some topics that we're going to be discussing, but of course there'll be some time at the end for any questions that participants have for our panelists. And so kind of to start things off, kind of keep it sequential with the timeline. I personally, I should introduce myself. My name is Philip Macadon. I'm also applying pathology. I'm at the University of Incarnate Word. But going back as an undergrad student or pre-med transitioning to med school, that's something I can reflect on and see how that's going to help me as a future pathology resident. What things did I experience? I know very well when I started med school, I didn't know anything, imposter syndrome, meeting new people, trying to balance the workload. So I wanted to ask Veronica this question, for you, what are some things that helped, help you click, help it click for yourself that you knew that pathology was for your specialty that you wanted to apply to?
Well, I was actually super lucky. I was exposed to pathology at a really young age, and I was always a very curious kid. So in the sixth grade, I did the 5 second rule experiment with a pathology lab and dropped food on the floor of the cafeteria. And then I worked with a microbiologist to swab the plates and swab the food. And that was kind of my first exposure to the path lab. And I just fell in love with all of the people there. Everyone is always extremely welcoming. There are so many different opportunities and subspecialties that you can go into. And that's also another thing that I really love about Path, that there's a correlation for every system that we learn in medical school. So those are definitely some of the things that drew me to Path. And I kind of knew going into med school that I wanted to do it. And it going through all the rotations and everything, I really enjoyed all of them. But there was always something about Path and meeting the people that were, mentors and role models at different meetings or during, I don't know, during school and meeting different pathologists, that there's something very welcoming about the whole field. And I just love that. And it's always people that are super interested and curious and like-minded. So it's a great spot to be in.
That's awesome. I'm just curious, what what things did you find on that 5 second?
Oh my gosh. Well, so first we did it with gummy bears. Nothing grew at all. because of all the preservatives and everything, which is a little weird, but I guess if you drop like candy on the floor, you can eat it.
It's
But
concerning for a different reason.
yeah, yeah. And then we did bananas, and I don't remember like what kind of bacteria grew, but we did like 5 seconds, 10 seconds, 30 seconds, and a minute. And a lot of things grew. So I would definitely not recommend eating bananas off the floor of the hospital cafeteria. But it did open my eyes to all of the different specialties. Like you can do CP, AP, microchemistry, all of those things that you're learning like throughout undergrad and in med school that you never think is like, oh, this is a specific specialty. So that's super cool that you also get to do like a lot of lab work, which I like.
Mm, that's amazing. And so I want to keep it as kind of like a continuing circle as opposed to, let's ask Veronica all these questions from med school to residency, and then we'll switch to Dr. Dar. We'll kind of keep going in like in a circle, kind of keep it so everyone's involved. And so for Dr. Dar, kind of similar question, on the flip side, when did you know that Heme Path was a fellowship that clicked for you that you wanted to apply to?
That's a really good question. And for me, so I didn't know right away entering residency, like, oh, I definitely want to be a hematopathologist. I already knew that I might be interested in it. Um, I feel like we're a little unique, going into pathology. It's like, oh, I think blood is like really cool. Well, it actually like it just is though, and it's and I think that's part of it was having like starting off with that innate curiosity, like Veronica mentioned. I thought I was going to lean more in towards molecular pathology, which of course applies to heme path, applies to really everything. So that was still a broad interest. I actually on I got to rotate on one of my electives in med school. It was the bone marrow transplant clinic. I think it was at Methodist Hospital over there. And I really liked, I mean, those patients are just awesome. And I'm not, directly patient facing right now. Did get some experience with that on our transfusion medicine rotations and residency, which I actually really liked too, but kind of seeing both sides of it, like the diagnostic process and then like all the follow-up you do with those patients and then integrating everything. I think I was really influenced by that. And so I think that was sort of underlying some of my interest in heme path. But then when I did my first rotation, I think it was kind of midway through my intern year. Uh, I mean, it's very challenging and in general this is pathology is really challenging. I think a lot of us welcome that challenge, but I was like, I never really lost interest in the content in it. It was just like super engaging for me, and I think part of that is you get to see so much different material. You get to see like the peripheral smear, you get to see the central marrow, you get to see tissue specimens, sometimes lymph nodes, and even just like you know lymphomas involving like basically any part of the body, and then integrating that, synthesizing what you're seeing morphologically with the ancillary studies like flow cytometry and molecular. It just kind of keeps everything engaging, even if you're doing like a bread and butter case, like a follow-up residual myeloma case or something. There's always potential for some element there to be interesting, especially as we start looking at stuff like minimal residual disease and we're just seeing all this like evolution of the testing in heme path too. So I feel like it's very engaging to me. It's not for everybody. I understand. I talk to people and they're like, I want to stay far away from that, and I get it. I feel that way about some things, which is why I really respect forensic pathologists and breast pathologists, etc. Mad respect. But I think that's really what I liked about it. And I think a lot of different subspecialties are kind of moving in that direction too, where we have more specialized testing that we need to integrate, whether that's certain immunohistochemical stains or certain molecular tests. That can look different as things continue to evolve. So I would say I'm kind of I listened to my gut, and that was kind of happening with me when I was in med school. I initially thought I was going to go into internal medicine, but pathology kind of snuck in there, especially kind of like Veronica was saying. that's just what we have the what is it, the integrated curriculum at UIW, where they teach pathology alongside normal histology, and so I think that helped expose us to it a little bit earlier too. So I think that was great also. And I guess the only other thing I'll add is heme path is a really, I think, perfect intersection between anatomic and clinical pathology, where a lot of other subspecialties will fall into one bucket or another. Again, I feel like molecular sort of is like the, it transcends everything, but I like that integration. So that's really what drew me to it, and continues to do so.
That's amazing. And you could definitely, hear your passion for heme path. So I'm glad that it clicked for you. And speaking of heme path, we do have a hematopathologist that's on our call here who is a practicing attending. And so Dr. Choi, kind of similar question. When you were finishing up your fellowships, how did it, I guess again, I'm using this term click. How did it click for you that you knew a job was the right job? What things, again, what clicked for you?
I actually love telling this story because I think my whole path has not been straight at all. It's been very circuitous. If you were to ask me 20 years ago, where would I be? This would definitely not be it. And this would not be, I would not have made the stops along the way that I would have thought I would have made. Um, so I did a fellowship in Derm Path, and then I did a fellowship in Heme Path. And in the fall of my Heme Path fellowship, as I was studying for my Derm Path boards, one of my attendings said, "Hey, how's your job search going? You know, give me your CV. I've got some friends who are looking for someone. You might work for them." And I thought, I'm trying to study for boards. One thing at a time. I'm not thinking about jobs. I just need to pass my boards. And it turned out, one thing, a tangent, one thing that I would encourage everyone to do is find out if you have a local pathology society. Find out if you got one in your city, if you've got one in your state. It turned out that my attending was at the Texas Society for Pathologists retreat, and she ran into a couple of friends of hers who are also pathologists, and they were chatting and just kind of saying, "Oh, are you guys hiring? What are you guys looking for?" And they said, "Well, I mean, we need another heme path." And someone said, "It'd be nice to have a derm path too, though." And she said, "Hey, I think I know someone who might be perfect for you." So I wasn't looking for a job. I got my CV cleaned up. I sent it to her. She passed it along for me. And then I got a call saying, "Hey, we want to interview you." And at the time, don't worry, my group knows this. At the time, I said to my husband, I mean, I just interview, right? Like, if anything, it's good practice, right? Just kind of poo-pooing the whole thing. But it worked out great. This is my first job out of training, and I've been here for, I'm looking at the year now. I've been here for almost 9 years now. So I would have never thought, I'm not originally from Texas. I would have never thought I would have stayed and come down here to San Antonio. I would never have thought I'd be in private practice. I thought I was going to be in academics because that's all I knew, from training by default, what we know is academics. Um, but yeah, it just kind of fell into my lap, and I would have been a fool to say no. So I don't necessarily have wise tips other than, you never know. So if something presents itself, try it out. You never know.
Thank you, Dr. Choi, and I definitely try to take that advice. Kind of never miss an opportunity when it presents itself. And so it sounds like, kind of going from Veronica to Dr. Dar to Dr. Choi, with Veronica talking about the exposure, the 5 seconds, and kind of piqued her interest in pathology. And then with Dr. Dar talking again a little bit more about heme path, it piqued her interest about heme path and wanting to pursue it. And Dr. Choi talking about, with networking and starting getting to know people. And so I think that's why events like these are great and kind of just getting to know people. And you can kind of see, I hate to use that term, but transition as we're constantly going through new places in life. And so now I'm going to circle back to Veronica. I'm going to ask you a question. Kind of on the flip side, what were some challenges during medical school that you experienced uh, that kind of that you had to go through to get pathology exposure or pathology rotations, anything related to wanting to achieve your dream or goal of attending pathology residency?
Oh gosh. Well, I think we were super lucky that we had a lot of pathologists on our faculty at school. So we got early exposure pretty much through like, the first week of first year, which was really awesome. Um, some of the challenges I would say are probably getting away rotations or getting exposure to other programs, which I know PathSIG does a really great job of giving all the open houses and all that information online. Because we were actually talking about this earlier, that now that all the interviews are online, it's kind of hard to like really get a true feel for the program. So I think like that's one of the challenges that I'm kind of facing right now, trying to rank the programs because I have, I like sent my letter of intent to my top program, but for that second and third spot, I'm like, I keep going back and forth, but it's really hard to know like which one is going to be a better fit. So I feel like, I was able to do a couple of way rotations and they were really great. Like I went to a couple different programs that I could see myself at, and it's really nice to be able to know the faculty and the attendings and the other residents as well, and just get a feel for the program. So I think like not doing as many array rotations as I could have done is kind of a little bit of a challenge for me right now, just because I'm like, am I going to fit in at the places that I want to rank? Um, but yeah, I feel like, it's been pretty good, like the 4 years of med school with path exposure, and all of the pathologists I worked with on rotations were phenomenal, and everybody is so willing to help you if you want to go into path. So that's just what I love about the community. Yeah, I could go on and on, but
No, that's amazing. It's almost as if could we consider flipping a coin as a great method for choosing your second and third spot?
I know, I know. I'm like, shoot. But I know it's all going to work out. Like Dr. Joyce said, it's all going to work out the way it's supposed to. So I have some faith in that.
Absolutely. And so, like say fast forward and now you're starting residency. And so now kind of a question for Dr. Dar, what are some challenges as, most of us or some of us on this call are, but hopefully fingers crossed will be incoming first year pathology residents. What were some challenges that you experienced as a first year resident?
Yeah, really good question. So, I think this gets said a lot, but you only get a little taste of pathology in med school, even though I feel like our med school did a good job of exposing us early. Like Veronica said, we have a lot of awesome pathologists on faculty there. It's kind of its own world and its own sort of universe because there are so many different elements to laboratory medicine, especially that play a part here. And then, like you mentioned earlier, there's a correlate for all of the organ systems as well. So it's sort of like, in a way, it's like drinking from the fire hose as an intern. But I will say, I feel like there's different personalities everywhere. But like Veronica mentioned, pathology, I feel like, is a really welcoming space, and attendings know where you're coming from and sort of what your baseline is coming out of med school in terms of exposure, and that's something that you can communicate as well. And so I feel like the challenge was, you rotate, and I remember my first rotation was on coagulation. And I was like, okay, that's, really specific. And we have an esoteric coagulation lab and we write up the von Willebrand factor panels and stuff like that. And it was just like so specific and sort of, nebulous. And that's kind of how clinical pathology can be. And then I, hard swung on my next rotation to intro to surge path and like just like grossing all day being on your feet. And so I think the first challenge is sort of having that, being able to shift gears really well. But I will say, you did it 2 years, 2+ years of clinical rotations, and that can kind of help you with that too. Um, Kind of learning how to, the first week it's like, okay, I'm just kind of figuring out the workflow of things, how, what the day looks like. Um, in terms of, the tests that come out and like who all's on the team, like learning people's names and everything. And then it's sort of like the beginning of residency is sort of learning how to pathology. And so you don't need to stress about like, oh, I need to study for boards right now, or even like have organized studying for step 3 right now, though I do recommend taking step 3/level 3 early if you're going into pathology, because it's not super relevant to you if you're not a clinician. But sort of just figuring out, what worked for you, that sort of spaced repetition that they talk about in med school. I feel like that still, it sounds cheesy to say, but I feel like it really does help with learning. Like you're going to come back, and I was like, okay, I can come back on my coag rotation on third year and, start dusting things off, and things don't feel so foreign anymore. So it's kind of about getting your feet wet in sort of all the different realms of pathology. I feel like was kind of the big adjustment there. And then by the time you're a second year, you can be taking call, a little bit more about how the lab works, and they give you a little bit more responsibilities, graduated responsibility and whatnot. And so there's maybe more things to do. Maybe you feel more comfortable taking on research projects or teaching opportunities, but it's you feel more comfortable with sort of the clinical service side of things. So you're able to, balance things out as a second and a third year. And I kind of ran away with your question there, but that it really is all about like all of those transitions. And I think pathology is great because we collaborate a lot. We really value joint attention. It's like, oh, I see something really cool, and maybe it's just like a crazy looking mitosis in the squamous cell carcinoma. Everyone come look at this, and everyone welcomes that sort of collegiality, or just getting excited about stuff together, and then that's great because we have to do a lot of the sort of more nebulous, drier tasks too, of like, troubleshooting and lab management, and then a lot of administrative things, which are the reality of, just medicine in general. And so we're kind of able to keep it interesting for each other. And I feel like you see that in academic and community settings too. So.
Thank you, Dr. Dar, and I'm glad that you were able to run away with it. That means that I'm asking a good question, I think, hopefully. But it sounds like mentioning the challenges that you're talking about. When I hear challenge, sometimes it has this like negative, like, oh, it's a challenge. Oh my gosh. But now it sounds like it's a challenge, but then there could be excitement associated with it, that you're learning something new and that you're in a completely different realm. And so I'm really excited to hear that. But it sounds like you have to face these challenges no matter what. So, and then I guess now transitioning, Dr. Choi, you can kind of guess what I'm going to ask you, but it's more geared towards kind of your first year as an attending, and what were some challenges for you as your first year as an attending? And I know, from personal experience, they could be a variety of things. And so I would like to hear your thoughts.
Yeah, I think it's kind of what Dr. Dar kind of already touched upon. When you first start out, you want to kind of settle in. I mean, I think this holds for any situation, really. If you're the newbie, you kind of want to just settle in, sit back, really kind of learn from those around you, kind of see how things flow. One great piece of advice, I mean, I still think it was a great piece of advice, was just say yes. I know we're told just say no, right? No to drugs. But they said, just say yes, because you never know what might actually strike a chord for you. So I'm thinking specifically of some of these committees when an administrative task comes up or a committee membership comes up. My initial thought was, no, 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 I'm too new at this. I don't know what's going on. I can't accept this. But if it's presented, I mean, try it. You'll learn. It's exactly what Dr. Dar said about challenges, right? There will be challenges, and that's how we learn. It will be stressful, but it's not distress, right? You can learn from it, and you never know where that may lead. That can lead to professional relationships, referrals. It can lead to friendships. So that was, my thought was you just kind of want to settle in. I don't want to take on a whole lot right now. And I think there's truth to that, kind of see how things operate. But if someone asks you to kind of step up, yeah, why not? Try it. I think, I don't know about you guys, but for me, I'm really afraid of failing. And so, no, I don't want to go out on a limb and do that just yet. But you never know. And that's when these leadership opportunities come up. One example is, like I had already mentioned, the Texas Society for Pathologists. They've got a great young pathologist section, and people were like, "Hey, do you want to be the secretary of YPS?" And I was like, "No, I don't think I can handle that. No." They're like, "Okay, well, think about it. Every year we get a new one." And after a couple years, I thought, maybe I should, right? Just say yes. Just do it, right? And that's been so great for me, because I get to meet all sorts of people, like trainees like you guys, but also attendings from all across the state and really even across the country, at some of these meetings. And we get to talk about pathology and really kind of, I think Dr. Dar said collegiality. I was thinking like geeking out, right? We can kind of like geek out together on pathology, right? And contrary to, popular belief, I think most of us are pretty normal and conversant. So that's actually been a real joy for me, and not something that I would have by nature instinctively agreed to do, but kind of thought, yeah, someone said just say yes. I'm going to try this.
Thank you, Dr. Choi. I really appreciated that. It sounds like I like this. I'm learning to say no, but now I'm gonna have to learn to say yes. I'll try to say learn to say maybe.
Yes, same.
I mean, I am a big believer in no is a complete sentence, right? Like, right? No stands alone. But, sometimes it's okay to say yes and go out of your comfort zone. You never know where that will take you.
Absolutely. And so before, I wanted to move on, it sounded like kind of going back again from med student to attending. Veronica was talking about getting like that exposure and pathology rotations and honestly kind of choosing what rotations to do and where to go. And then Dr. Dar was talking about, once you're in residency, there's different rotations, coagulations, surge path. You're going to be, again, thrown into new worlds that you haven't really been touched on in medical school. And then Dr. Choi was talking about learning to settle in, say yes, kind of, be part of a committee if you're offered to. So those were kind of some of the challenges that was talked about. And now switching back to Veronica and kind of a different perspective, personally, when I start looking at a transition from med student to residency, I'm looking back from, as a pre-med to medical school. If you were fortunate enough to have multiple acceptances, one of the things you consider are, different factors of why you want to go to a different med school. For example, location, size of the med school, what do they offer? And so now, Veronica, I wanted to ask you, what factors are you looking at when you choose residency programs? What factors are you looking at when you make your rank list?
Sure. I feel like the most important thing for me is having support from co-residents and attendings. Um, I've seen a few programs where it just feels like, you're annoying a pathologist when you're asking them questions. And I really would love to be somewhere where like I can ask as many weird questions as I want, and they're so receptive to it and they love to teach. So that's a huge thing for me. And I feel like I see that a bit more with academic programs where they're just very prone to wanting to help you succeed, which I love. So that is definitely a huge thing for me when I'm thinking about my rank list. And, I mentioned academic programs. I also feel like academic programs just have more opportunity. You can stay in academics. There's more opportunity for research opportunities. And I feel like if you start out large at an academic center, then you can basically choose like I'm going to stay here or I'm going to go somewhere private. I'm going to go to community. And so I feel like that is another draw for me about the programs that I'm trying to rank highly. So support, uh, opportunity, and location too. do I have people who are in that same area that are going to be able to support me through residency as well? So I feel like those are the big three things that I'm looking for in a program.
Follow-up question, how did you approach kind of gauging the vibes, of a program that were supportive for you?
Yeah, that's actually funny that you asked that because I was just gonna say like you can just feel a vibe at certain programs like, oh, I could totally vibe here with the attendings and the residents. I just feel like it just on the interview, like you can just tell when you're having conversations with people, like, are they genuine? Are they supportive? Are they kind? And I feel like those are huge things for me as well. I also am not afraid to ask like other residents, like, do you feel like the environment is very supportive or do you feel like it's competitive? Because I don't really thrive in competitive environments and I wasn't really afraid to ask questions like that. Um, but some you can just tell that, they're genuine people who are excited about Path, and that's a place where I want to be as well. You just get that vibe.
Yes, absolutely. Especially on interview days that have a social night, virtual social night with the residents prior, the day before the interview or a few days before. And I didn't realize at first, but after a few interviews, I realized that was really truly a time that you could ask residents. Real questions that were important to you. And I didn't learn because when you're interviewing, you thought no matter what they say, you're always, obviously you're on a magnifying glass, but during social nights, if they did have that before an interview day, it was a great time to kind of get the vibes that you're talking about.
Right.
How do people act not in the presence of an attending, not in the presence of a chief resident, stuff like that. So I totally agree. I'm on the same boat. Vibes are very important for me as well. And so, Dr. Dar, kind of similar question. What, I guess, factors were important to you when you were choosing fellowship programs? I know you're a Heme Path Fellow now, but at the time when you were applying to fellowship programs, if you did apply to multiple, what factors were important to you?
Yeah, so I will say like I said, I didn't know exactly what fellowship I wanted to pursue. I anticipated probably doing at least one going into pathology residency. So I wouldn't say, you know, stress too much about what fellowship you want to do when you're just applying to residency, but I did pay attention to programs I applied to because I was curious about, oh, do they offer fellowship programs? What fellowships do they offer? Is it a ton of them? Is it just a couple? And that kind of gave me an idea. And a lot of the residency programs I ultimately ranked offered uh, some like not all the same ones. Some are more common than others. Um, but that was sort of like the broad initial uh, thing I kept in mind when applying to residency too, was maybe I'll want to go to fellowship somewhere where I end up matching. So that's something to keep in mind, just like very, very generally. But I did apply to a couple of Heme Path fellowships, and I got to rotate a lot at Vanderbilt. I did my residency here as well. And so I definitely valued that experience here a lot. So I think I was leaning towards that, but I did look at a couple other places. Um, and it's sort of similar applying to residency. Like, is this going to be in a location I can see myself living? Like, are you going to be, you know, traveling with your family there? Is it 1 year or is it more than 1 year? Like, kind of thinking about all those things, like how much time do I want to invest in that? How far am I willing to move? Do I want to stay in this area? So kind of those similar questions as well. I would say that when you're looking at subspecialty training, I think there's a lot of overlap in the different programs in terms of the content that you get exposed to. One thing that I remained drawn to Vanderbilt because they're a large transplant center, both solid organ and stem cell transplants. And so I knew it would offer, the volume and the diversity of cases that I was used to, with room for that to grow as well. And that's something I think people talk about with applying to residency programs as well, is am I going to get exposed to the cases that, the common cases, the uncommon cases, generally a diversity of cases, both in terms of the content, the entities, and the patient population. So I think those are some things to consider out in terms of applying to both residency and fellowship.
Yeah, you brought up some great points, and I think you and Veronica have kind of similar points here, where exposure, wanting to apply to academic places that exposes you to the different caseloads, so that when you're practicing, you're not struggling when you see something that you haven't seen before. And then so I heard on the interview trail, one piece of thing that stuck with me is when personally when I'm choosing a residency program, look for places that would have PD, like a children's hospital. So you're exposed to pediatric stuff. Not every place has a children's hospital. And also cancer center, NCI cancer centers. There's not many in the US. I think there's about 50 some in the US. And then possibly VA exposure, because that's more of a general, search path if that's something you're interested in. So, you mentioning the exposure and Veronica talking about the exposure, that got me thinking about, what some factors that people may be looking into. And so, Dr. Choi, this is kind of a flip side, different side of the question. What qualities are you looking for in an applicant to work at your practice? Now that we've mentioned factors that we're looking into residency fellowship programs, what are some of the qualities, or I guess, attributes that you look for a potential applicant to join your practice?
Yeah, that's a great question. I think it works kind of both ways. My big thing, and I think that for the group in general, it's really just fit. How well does this person fit? It's exactly what you guys have already been talking about with each step of the process, right? Do you see yourself vibing there? Like, can you hang out with these people? And what I tell people when we interview them is, like, look at that too, because that's what we're looking at. Think about that. We certainly don't have to be best friends. You don't have to be best friends with the people you work with. You don't even have to be friends, right? But it certainly helps. We spend more time with our colleagues on a given day than we do awake with our families, right? So I think it's really important. I think we value that a lot. And it ends up, like some of us are friends outside of work, and, our families will get together for brunch or dinner, or, some people go on vacations together with their families. So it's not necessary, but it certainly makes it a whole lot easier. If you're working with someone that you like and can trust. And I think, it kind of, I was just trying to decide if I wanted to break it down into like specific areas, but I think it works generally. How do people view, now I'm kind of flipping it. When you are an applicant applying for jobs, how does the practice view, the practice, right? Like, how do they view your role? What do they expect from you? Just like, what would you expect from them? I think it's all about fit.
That's a great statement. There's no, that's the most simplistic way to put it, but it works great. I love that. And I like that you were talking about, what does the practice do for you? I guess that's another factor that I'm trying to take into consideration with the rank list. What does the program director do for the residents, right? What do they do? What do the APDs do? Are they getting the feedback? And so similar for a job applicant. And I really appreciate that. And so I wanted to take a moment here, though. I do have a lot of talking points. I could keep this going forever, but I wanted to pause for a second and give an opportunity to any of the attendees. I'm sorry, Dr. Cook. Attendees, if you guys have any questions you would like to ask our participants or our panelists. we have a question in the chat from Ansi. Thank you all for sharing your insights about pathology today. It was really inspiring to hear your journeys.
Okay. Have you thought about pathology? And I'm pretty sure I laughed in his face. I'm so sorry, Dr. Riccanati. And I said, what, you think I'm antisocial? And he said, no, I think you really like research. And it goes back to the point that Veronica was making. I was talking to him about the research fellowships I wanted to do. You know, I was going to do one in the summer after first year of med school. Then I wanted to apply for a fellowship and take a year off in the middle of med school. And he was like, have you thought about path? And I said, thanks, but no thanks, right? Like, no, I came here to take care of patients. So flippant, right? So no, I didn't think I was going to go into pathology. It wasn't actually until I was in internal medicine as an intern that I really started to think about pathology. And that was really because those hours were rough. 100 hours a week on the wards. I was given some elective time. And so I did a 2-week elective in interventional radiology and a 2-week elective in pathology. And one of the path attendings I worked with, she had also done some internal medicine. And so we were kind of talking, and I said to her, do you miss the direct patient care, like the face-to-face patient care? And she was like, no. And I thought, gosh, you guys seem normal. And she said, well, yeah, most of us are, especially the younger ones, maybe not the older ones, but it was kind of eye-opening because I'd never really thought about it before. And so I went home and I kind of said, I might make a switch. And my husband said, if you're going to do it, I mean, yeah, do it now before you keep going down this path, right? No pun intended. And so I ended up doing a research fellowship. After that internship, I did a research fellowship, and then I ended up applying for pathology from there. And so I wouldn't have thought that I would be in path. At that point, I was all primary care. So you never know. And when I was in residency, I did email my advisory dean and I said, hey, so guess what I'm doing now? How did you know? And it turns out he was primary care. He's family medicine, which is why he was my advisory dean. He had started in path residency, but he missed the direct patient care. So he kind of knew about pathology. He knew what it entailed. He knew the type of person that really kind of thrives in that setting. And that's why he was presenting it to me. And I mean, I didn't even carry on the conversation, right? And that's why I'm saying, like, you never know. Take it with, like, don't necessarily do what other people tell you to do, but think about it. Step back, look inward, and kind of go, could I? And if that's something you even are remotely thinking, kind of like we had already talked about, touched on a little bit, trying to create those opportunities for yourself if they're not evident within your program. Shadow a pathologist. I love it when medical students in their first and second years even are like, hey, I've got an afternoon off. Could I maybe come and like sign out some cases with you? That's awesome. Because yeah, even if you come here and spend time with me and you go, oh, I can't do this. That's okay, because at least right? My big thing with medical students is I don't expect everyone to go into path, which should be great. But know who we are, know where we sit, because no matter what you do in medicine, you're going to interface with a pathologist one way or another. There's going to be a pathologist who oversees the lab that you are sending your patients to for a CBC, right? We touch kind of all aspects. So know where they are. If you've got questions, one of the hemoncs called me today and she said, oh my gosh, this is not one of your cases or even one of your groups, but what would you do with this? And I love that because she knows I exist, right? I always joke that we just want to be invited to the party. But that's my soapbox. Know who we are, know where we sit and how to reach us. And don't hesitate to call if you've got questions about stuff. Because I'd rather you call and say, hey, what test should I order if I'm wondering about this? rather than ordering the test and then finding out later that you've ordered the wrong one, right? I remember there was a doc who was testing his patient for celiac disease and ended up ordering the pork allergy test instead. You know, Dr. Google nowadays, hopefully we can prevent some of that, but certainly call the lab, call the pathologist. We're here to help you. So that's my soapbox, and that's my path. Yes, no, I would have never thought I'd be here 20 years ago.
Thank you, Dr. Choi. I always love hearing your stories. It's great. We have another question in the chat from Tracy. Thank you to all. I'm interested in pathology and about to start clinical rotations. I am wondering if any of the panelists have insights about continuing to explore pathology alongside clinical learning in this setting. If either Veronica or Dr. Dar, if either, I think maybe Veronica, if you want to.
Sure. Yeah, I can answer this one. Great question, because I feel like, the first year of rotations is basically like the bread and butter stuff, not a lot of pathology exposure. Something that I found pretty helpful was mentioning to my preceptors that I was interested in path. If the opportunity presented itself, if I could follow specimens down to the lab or like even just reading the path reports when you're charting, because like basically all of the information from the hospital is from the path lab, like the results for your CBCs, like Dr. Choi said, the biopsy results, immunohistochemistry, immunology, CMPs, like all of those things are from the path lab. So, yeah, I guess like during surgery, I was allowed to follow specimens down to the path lab, which is pretty cool. And they're always so excited to have you. Like, if your preceptor is chill enough to let you do that, I highly recommend it because they just get so excited when a student goes down. And then another thing would be definitely trying to get early exposure, like before applying to residency, by doing a few path rotations. Like, if you're really dead set on it, then that also gives you something to talk about in your interviews for path. So I think like my first path rotation was in July or August over the summer. And that really helped like cement, I want to do path. And then I got to do like clinical path and anatomical. So just showing your interviewers that like the whole realm was super helpful as well. Yeah, and they just love having you there, which is like the best part because you just feel like you're a superstar walking in there. Like all of the pathologists are just so excited that you're interested, and that's like something that has definitely drawn me to Path. Everybody being excited
I'm
about
just
it.
gonna interrupt. I'm sorry. Do you guys watch those reels from Dr. is it Glocken? Oh my gosh, it's so funny.
Yeah.
You go visit pathology. Definitely do it. Because like I said, we just wanted to be invited to the party, but if you bring the party to us, we're even more excited. Absolutely, absolutely. And I know it's not my turn yet, but seek out local pathologists who will let you come and sit and hang with them. If I don't I don't know where you're at, but even just for like an hour or two. And I've had some medical students call in to join tumor board. We have tumor boards on twice a week in the morning at 7 a.m. And so it's all virtual now, and they'll call in. And then you can also kind of see how pathology contributes to interdisciplinary care. Again, like these are the radiologists, the surgeons, the rad oncs, the oncologists. They know who we are and they know our value. And I think that's really kind of nice to see. And I wish I knew about that earlier on instead of thinking that pathologists were like weird and sitting in the sub basement with the morgue and all that stuff. But yeah, absolutely. Just if, I think I will put my contact information into the chat. And so you guys can certainly feel free to email me. And if you're local, I can certainly help facilitate something. If you're not local here in San Antonio or even Texas, let me know. We can find ways to work that out. But yeah, absolutely.
Thank you, Dr. Choi, for willing to share your contact information. Dr. Choi is great. We all know her, and she's so friendly, as you can see, and passionate about pathology. And then also Veronica talking about, doing your path rotations early. Tracy, by the way, is also part of virtual PathSIG. She's a phenomenal social media co-chair. So thank you for asking that, Tracy. But similarly, it's like you go through your third year and you say, yes, interested in pathology. And then you have this opportunity, you do your first pathology rotation in fourth, you're like, okay, here I go. I've been saying this whole time, I'm interested in path. I really hope this works. And luckily it did. And so um, I just say that because it kind of resonated with me, like, oh my gosh, I've been doing this whole time. So I'm lucky that I did it early. Another piece that I think helped me was attending, as Dr. Choi mentioned earlier, um, kind of pathology meetings. There's several, I mean, there's CAP, there's ASCP, there's the local, if you go to your states, there's the Texas Society in Texas, but that's a great way to network as well while you're doing third year clinical rotations. Okay. So we have another question in the chat from Ansi. And again, this event is until 4 p.m. So we'll try to, answer as many questions as we can. So Auntie said, as someone who has completed Path residency and fellowship, could you share what program directors and selection committees typically look for when shortlisting applicants? Also, what are some meaningful ways applicants can strengthen their CVs to clearly demonstrate genuine interest in pathology? Dr. Dar, I think I'm going to have to pass this on to you.
Great questions. So I have done a good amount of interviewing residency candidates and now a little bit of fellowship candidates as well. And I don't know all the, sort of initial like filter criteria that they use. I think in pathology, there aren't going to be a lot of programs that care like, oh, you got a 250 or whatever on your step exam, like that, they'll pay attention to all of that criteria. But I think, you're already answering the question here, which is demonstrating that you have a genuine interest. And this comes up on I think the Dr. Glockenflecken video sometimes too, where it's just like you just showing up and like appearing in our search path sign out room is super exciting. So and it's not just that, maybe it's that pathology historically hasn't gotten as much love, and we say, the demand for pathologists is projected to really exceed the supply. Currently, like we do want, people interested, but it's not just about like showing up and having a pulse, but like going, the next step. It's basically, ask any questions, kind of like Veronica was saying. A lot of the environments that you're going to be in, really welcome you being inquisitive and just like, even if it's sort of a weird question, it doesn't have to be something that makes you, look like, oh, I've been reading Robbins cover to cover or anything. Like really just whatever like sparks your curiosity. It can be about, some aspect of the procedure, like the surgical procedure, a grossing procedure, just like asking about workflow. So really just like showing up and demonstrating that interest. And then in order to translate that on your CV, mention, I shadowed here, I did like an observership here. I, got XYZ, you can write like little like bulleted experiences that you got on your pathology rotations as well. You can mention really any sort of participation in like your local pathology interest group. Mention your participation in like virtual pathology interest group as well. And also, demonstrating, if you have gone to any of the conferences that Phil mentioned as well, it just shows that you're relatively engaged. And again, pathology attendings know that there's like kind of only so many opportunities that you get as a med student. So just showing that you're at least making that effort, I think goes a long way. And I think for me as well, I things don't have to live on your CV forever. Like over time, I feel like it starts to get kind of longer because projects will come up, things will come to you. You will say yes. It's good to consider saying yes in residency and learn how to say no. But like Dr. Choi said, consider saying yes to things. And as that happens, things don't have to stay on your CV forever. I'm like, oh, I wasn't really attached to this research project I did in undergrad, but you never know who's maybe interested in something, like even if it's not super like directly related to pathology. Also, like Dr. Choi said, most of us are pretty normal, and we like to know that the people we're potentially working with are, a joy to work with, and you can, sort of pick their brain about different aspects of their their path to getting here. And so like I did a study abroad program in Costa Rica that was field research and had nothing to do with basic or translational research or anything or clinical. But people love to ask about that because, there are people who have travel interests. There are people who have, they like to read and they like to bake. Pathologists like we like to read and we like to talk about food. So that's always a genuine interest too. So kind of, demonstrating that sort of rounded experience that you've had as an individual is beneficial as well. I feel like those hobbies and interests are things people like to talk about a lot on the interview trail. I don't know if you all saw that, but we like to get to know each other and you know, like Dr. Choi said, you're going to work with these people a lot, especially as trainees. Um, so having opportunities to interview is valuable as well. And I'll drop my email in here too. If you have more specific questions, I can give you some CV feedback, formatting wise as well. Happy to do that.
Thank you, Dr. Dar. A lot of that kind of goes back to what Dr. Choi was saying earlier, the fit that people are looking for. And so being kind of aside from pathology, what are the other things that you do? And I know from my experience and interview trail, a lot of times we talked about my hobbies, which was the shortest part of my application, or like it's like, the one little thing is what we talked most about. So if during your interviews, be ready to talk about your hobbies. And so I did put in the chat. I did respond to as quickly as I could to Jacob's question about doing path rotations. Um, and then I also put in the chat a link to our X virtual PathSIG account. I put that because we post events there. It's not just on X, on Instagram as well, and social media. But we're also having our applications open for new board members. So that's a little plug there for people that are interested in wanting to do this in the future. But this concludes today's event. Thank you, Veronica. Thank you, Dar. Thank you, Dr. Choi, for being a panelist and talking to us and our attendings today, our participants today. I really appreciate it. And this has been recorded, so it will be on YouTube. I did halfway kind of stop for some reason, so there might be a pause in between. But thank you again. We really appreciate you and really appreciate everyone attending.
Thank you so much for having us.
Thanks for organizing.
Thank you.
It's great. Thank you.
Thank you, Dr. Choi. Thank you, Dr. Dar.
Thank
Bye.
you.